name is Stephanie Sweeney, and my name is Brianna Wright, and we're sophomore athletic trainers at Cedarville University. Today we're going to be going through emergency care protocols for a closed, non-displaced tibia-fibula fracture. Typically you don't see these fractures at a cheerleading practice, but you need to be prepared for any of these circumstances at any time. You never know when something's going to happen. Right now, Bree's checking the scene, making sure it's safe for her to enter. We're looking for pools of blood. Overall, just making sure that it's safe for Bree to take care of the athlete and to make sure that she doesn't need immediate further assistance. All right, what happened?
It dropped me and it over to my leg.
All right, where does it hurt? Right here? Okay. There's no swelling. There's no obvious deformity. I'm gonna need you to tell me where it hurts, okay? So. Bree just went through her history and observation. Based on what we saw and what we heard, we're guessing it's a tibia-fibula fracture. Right now she's doing a squeeze test, checking for a fracture. Here in a second she'll do a bump test, also indicative of a fracture. We just need to check and make sure, even though we're pretty sure that's what it is. Can you get the back of this one for me? Alright, can you scroll over on the back? Straighten this leg. Since we're pretty sure it's a fracture, we need to splint the leg. So Bree has chosen to use a vacuum splint. What this will do is, it has little beads in it. When we suck the air out of the splint, it will form to her leg, almost forming a cast. Now the reason we can use this is because it's not an open fracture. If it were an open fracture, we risk puncturing the bag, which would release the beads. It could cause possible infection, and it wouldn't be nearly as supportive as it will be now. The way it works, this pump is going to take all the air out, and that's what's going to give us that hard structure. Now we do have a couple of different options for splints. You can use a SAM splint. It's basically just a gray roll. It has aluminum on the inside that will form. Now the way we would use this in this case is you could either roll it, form it underneath, and kind of fold it up around. We could put it around the bottom of her foot and bring it up. Either way, we're just trying to provide stability. In this case, we're choosing to not use that because this isn't going to provide nearly the protection that this will. There's always going to be at least 2 exposed sides of her leg if we only use the one splint. We don't have one of these with us, but you can also use an air splint. Basically, it's like a giant tube that you would use in a pool, like a floaty. It would fit around her leg, and we would flow air into it, and it would form a softer but more protective than the SAM splint kind of a layer. Before Bree put the splint on, she checked the pulse to make sure that there was still a pulse distal to the injury. She's checking again now that we have the splint formed and ready. We're making sure that the break didn't either pinch or completely rupture the arteries that are running through her leg. If they did, we would need to immediately call 911. In that instance, you have about 30 minutes from the time the artery is ruptured to the time we would need to activate EMS, get them on their way, get her to a hospital, and put her into surgery immediately. In this case, we don't have to worry about it. So we could call 911 to get her there, but she's doing fine. She's handling it extremely well. She still has the pulse. So we're going to give her the option to either call or we can take her in. Either way, we need to get her in as soon as possible, but she's a trooper and it looks like she'll be okay.